Hi, welcome back to Africa as a Country, or in short, AIAC Talk. This happens to be episode 22, and it is our first of the new year. If you've forgotten who we are, I know it's like in this age of short attention span, in which direction last week is displaced this week by, I don't know, what's this week's story? A new president in the United States. I am Sean Jacobs, and I'm streaming from Brooklyn, New York. With me is Will Shoki. He's in Johannesburg, South Africa. We are the co-presenters of Africa as a Country's weekly discussion and interview show. Our producer is Antoinette Engel. She's in Cape Town, South Africa.
And if you missed our last episode, December, which was basically our end of year or Christmas show, you can watch clips from that on our YouTube channel or check out the whole thing on our Patreon, along with all of the episodes from our archive. And that was a great show. We brought back a ton of guests who've appeared from the last 6 months to basically just go over the depressing scene that was the world in 2020. It wasn't that much of a cheerful show, even though it was good fun. And we tried to look ahead, if there is such a thing, to 2021. And now we're here, and we have a fantastic program for you today. We're joined by two wonderful guests, Achal Prabhala and Dr. Indira Govender, who will be talking to us about the politics of COVID-19 vaccines. First, we have Achal, who's a campaigner for public access to emergency drugs, and he will break down vaccine politics. And then Dr. Govender will talk to us about the COVID-19 vaccine skeptics. We want to understand what kind of politics drives a lot of that anti-vaccinations sentiment, the skepticism, and everything in between.
So if you're not familiar with the show, what we usually do is we open our proceedings by commenting briefly on another political event, which is not the thing that we're discussing with our guests. And in this case, unless you were under a rock or you just not paying any attention, last week Uganda held it had an election. This was the sixth election, I think 96, 2001, 2016, 2011, 2016, and now 2021, which is that since Yoweri Museveni took power in 1986 in a military coup, and then 10 years later he ran like the first elections. And what was, again, we don't have to surprise you, he won. He won. With
no surprises there.
He won like a Lakers season with an asterisk behind it. But let's not talk too much about it because it was a serious matter. In fact, I mean, it just to name a few things, and then I'd like Will to kind of just, if we could just quickly talk a little bit about, this question of like, does it even matter that like Ugandans should vote? I mean, it's like, and again, we're not there, so we can't say how people should conduct their political struggles, and we will support them, while they're in it. I mean, there's no debating about it, but this is Museveni winning elections 6 times in a row, and how he does it, there's nothing right about it. And I'll just quickly summarize some of the elements of it. Basically, harassing the opposition in the lead up to the day of voting by mass arrests. Right now, I think even though the election is over, Bobi Wine is under some kind of house arrest. He can't leave his house. This is the opposition candidate. He can't go buy food. I mean, it's out of control. The using on the day before the election, sending in a special army unit to like patrol the streets, particularly in opposition strongholds. But I think what was striking about this was, so in the past, Museveni would usually run against sort of some of his contemporaries, people who were in the liberation movement with him, because remember there was Bolton Obote was in charge in Uganda. Museveni lost an election. He went to the bush. He led a military struggle. He came out and he came into power. And so over time, his own people in the NRM, they lost sort of confidence in the movement, and they went into opposition. Some of them ran against him as president, but he was just very good at cutting them down, like arresting, harassing, some of the same tactics he's using against Bobi Wine. But the interesting thing is, it seems like this time around, it was different. Bobi Wine, them had managed to puncture some of the support or the control that they had over the NRM had over rural areas. And so it made for an interesting election. This was also an election, despite the fact that they tried to shut down the internet. It came with a hashtag, "We are removing a dictator." I mean, it was just incredible. It seemed for once, and again, we've written a lot about Bobi Wine. He's not perfect. There's a lot of contradictions, but as a starting point, Ugandans want democracy, and it was clear that something was coming here. And then in the end, we just get this like weird result: 56 for Museveni, 30 whatever odd for Bobi Wine, which we know is also like a tactic in sort of autocratic regimes. It's like you can't win by 99% anymore, so you have to like pretend that you just got the plurality of the votes and that the opponent got like he's whatever 30%. So in any case, well, what did you make of like all this like politically? I mean, is elections like, is this still a tactic, particularly in this sort of like really what seems like this is an autocratic state?
Yeah, Sean, it's as you've already laid out, it's hard not to sink into despair when thinking about how it always just seems every single election is going to be a fait accompli. The incumbent is always going to win. They control all of the key institutions, all of the key structures of government. And so they have this asymmetrical power to ensure that things go their way. And when you look within the region, a similar thing is happening in in Uganda's next door neighbor, rather, in Tanzania. These tactics that we're seeing, especially of shutting down the internet in the week of elections to try and suppress dissent, because information is increasingly playing a crucial role in how people come to perceive their political situation. But I do think what's interesting is that if you listen to Museveni's interviews, it's almost as if he feels more, let's say, paranoid than he ever has about the viability of what he's doing. I think one thing that he repeatedly keeps sort of identifying as a trend in Ugandan politics is he talks about Wine's constituency as being constructed mostly of urban lumpen proletarian youth, and he's always dismissive of them. He talks of them as these young troublemakers who have no idea about the real concerns of the people. And in Museveni's imagination, the real people of Uganda are the rural strongholds that he still exercises. There's a lot of power over, but which are also slipping from his grip. And I think what we're noticing here is this dynamic where I think there's an increasing generational divide in a lot of African countries, and younger people who are more tech savvy, who are more, who have a lot to say and who want to play an increasing role in shaping the future of their country are starting to do that. And I think that, it's very easy to look at this situation and to as I began, say, well, this looks like nothing can ever happen to unseat Museveni's power and to feel despondent about it. But I do think we're going to start to notice how this contradiction in Ugandan society is increasingly going to become untenable, and it's going to explode somehow in some way. It's already starting to do that. When that happens, it won't be pretty. I think it's going to be very ugly. But I do think that there's reasons to be, I guess, I don't want to say optimistic because there's nothing to be optimistic about, but I just feel like the objective conditions of Ugandan society, the country Museveni took over in 1986 is very different now. There's also a global capitalist crisis and things are going to worsen. And as those objective conditions start to play a role, people are going to start responding and they're going to start wanting more and making demands of that, no matter how bad the suppression gets. I think we're going to see more of that.
Right, yeah. Museveni sort of wavers between, as you said, kind of paranoia and trying to remain, to stay up to date, trying to pretend like he's cool. So exactly, there's videos on the internet of him like making a rap song. There's other of him. We were looking earlier today before he came on the program at this video where he's doing exercise inside his office, and this is from like last year during the height of COVID, and him saying that people should be exercising in their houses. And as somebody sort of pointed out, he doesn't realize that most, that's not the reality for most poor people. I think the one thing that as I said, he's sort of wavering between kind of paranoia and wanting to show that he's connected. It's interesting that he also, which seems to be the last vestige of this kind of leader, he now pretends like he's some kind of old man, rural, sort of grandfatherly, that he doesn't read much, that he's just like a simple man. And you then discover that in the 1960s, he studied political science and economics at the University of Dar es Salaam, or that in 1986, when he came to power, he had very good connections within the academic community, and in fact, I think he hired Mamdani to do to lead a commission into the reform of local government. Of course, as we later learned, they did not take Mamdani's advice, and Mamdani himself wrote about that in the book Citizen and Subject, showing you that at the heart of what also reproduces power in a place like Uganda is that a lot of the elements of colonialism had been retained in the system. But in any case, we want to go one more, then we have to bring in our first guest. Yeah.
This relates to where you're at currently. You know, America's going to inaugurate a new president tomorrow, right? And one thing that a lot of people have written about very well is about how Museveni's power ends up being entrenched by how much the United States backs him, because he plays a strategic role trying to ensure peace in the region, fighting the Al-Shabaab threat in Somalia, fighting the threat of rebels in the DRC, and so on and so forth. So it'll be interesting to see if there's going to be a shift in foreign policy from the Biden administration. There's no Samantha Power is in that administration, so who knows if that's going to happen. I think maybe the door is more open than it ever has been to put pressure on the United States to shift its foreign policy position.
Right, that's the one, exactly. We want to make the transition to our first guest, but just quickly on this, we have an article actually on Africa as a country about the US's role in all of this, like what we, politics is local, we get that. There is about the reproduction of power, is about coddling local elites, handing out businesses, whether it's oil or mining. All this play out in Uganda. There's loads of people who've made money off the kind of Museveni regime, but it's also true that Museveni plays a role in that region. There's an article on Africa as a country, it's on the screen right now, but there's a great article, I think, short though, in the Daily Maverick today, that's also about the same kind of support that Museveni enjoys in the region, because he's kind of a proxy, in a way, the proxy of the US government in the region. Anyway, let's get to our first guest.
While we're on the subject of global imperial power structures, this is a good time to bring on our first guest, who today is Achal Prabhala, and he's a coordinator of the AccessIBSA project, which campaigns for access to medicines in India, Brazil, and South Africa. He works between those three countries, but is mostly based out of Bangalore in India. And Achal, we're excited to have you on. We think that you're doing some fantastic work at the moment. And before we talk specifically about the COVID vaccines, we would like to know, what does AccessIBSA do?
Thank you. It's nice to be here, and nice to meet you, William, and nice to see you again, Sean. I work on Brazil and South Africa. They're remarkably similar countries. They lead the regions they're in. They have industrial capacity. They have the political and economic clout to occasionally go against what the European Union and the United States want them to do. And they've all had a sort of shared long history of working since about the AIDS crisis. So since the turn of the century, on finding ways to make life-saving medicines cheaper in these countries so that their governments and societies can function. But look, I know I'm not allowed to digress, but there's actually a very interesting intersection to the previous segment you just ran. So one of the people I most admire, who I work closely with and I immensely like, is Winnie Byanyima. Winnie Byanyima heads UN AIDS. She's an Undersecretary General of the United Nations, and her husband is Kizza Besigye, who has been routinely locked up, actually, over the years for his immensely growing popularity with the Ugandan electorate, who decided not to run in the elections this year, and I think therefore escaped the same fate that Bobi Wine and others suffered. But this is just an interesting parallel. She actually worked with Beni and Kizza Besigye and others fighting in the bushes through the Idi Amin and the Milton Obote regimes, which they sought to overthrow. So she's a fascinating person, someone I personally greatly admire, and someone whose attention to both the global AIDS crisis, as well as in particular, in this instance, fighting for access to coronavirus vaccines, I think has been about the most effective of any campaigner working in this pandemic.
So just before you mentioned that there's a kind of a struggle since the sort of the turn of the millennium around access to medicines. Can you just kind of like briefly, and I know you can, as I said before we came on the air, you can write an essay on this, but can you just sort of briefly take us through that struggle more recently, and kind of where the major victories were that people are trying to build on as we kind of now deal with the struggle around drugs for COVID?
I'd love to, Sean. I'm also going to digress a little bit with you, though. I have a second point of digression. So yesterday was Binyamanga Wainaina's birthday, and I remember that 6 years ago, his coming out essay, "I'm a Homosexual Mom," which both you and I were involved with and talked about exactly 6 years ago to this date. And I did feel that the first time Africa as a country comes on air in 2021, one day after Binyamanga's birthday, it should be mentioned somewhere. So I did. Right. So what happened at the turn of the century was the confluence of a couple of things. In 1996, the World Trade Organization was created. 1996 was also almost exactly the year when people discovered that AIDS was not a thing that primarily affected Western countries, Europe and America, but in fact actually most affected third world countries, especially sub-Saharan Africa, but also large parts of Latin America and Asia. But 1996 was also the year another really wonderful thing happened, which is that AIDS activists in the United States put pressure on their very conservative governments to devote resources to treatments for AIDS. And what they created in 1996 was something called highly effective antiretroviral therapy. So what this meant was that AIDS went from being a death sentence to being a chronic condition like diabetes. Except it came with a cost. It came with a cost of $10,000. And it came with the backing of the World Trade Organization, that it suddenly created this global regime of intellectual property rights that even very poor countries had to adhere to. So South Africa exploded in the late 1990s. Zaki Ahmed and a group of his colleagues created the Treatment Action Campaign in honor of Simon Nkoli. Simon was an anti-apartheid activist, a member of the ANC, and someone who was also out, gay, and HIV positive. He died because of a complete lack of access to antiretrovirals. They weren't even available in the country at the time that he died. And the Treatment Action Campaign was founded in his honor. And that really was the epicenter of a global movement that sort of mushroomed out of there and spread its tentacles to Brazil, to India, to Thailand, and a range of other places. And then over the years, ratcheted up a bunch of really, really good wins. I mean, the first being AIDS, the fact that by about 2006 or 7, a combination of this incredibly fierce activism and I think the inability of pharmaceutical companies to deny access to AIDS medicines any longer because the shame was just getting too much, created a solution to the problem. The pharmaceutical industry did incredibly stupid things. The joke that I like actually is a pharmaceutical industry was asked a couple of years after 1999 when they sued the South African government why they thought it was a good idea to sue Nelson Mandela because he was the president at the time, 5 years after 300 years of brutal slavery. And he said, look, we had to. Mother Teresa was already dead. And in retrospect, it's funny. As it happened, it was incredibly tragic. Many rich countries played a horrendous role, actually, in preventing South Africa from gaining access to AIDS medication that it could afford sooner and faster. It was a tragedy, but they won. There were subsequent wins of a kind. There was a cancer treatment in India called imatinib for chronic myeloid leukemia, a form of blood cancer. India fought a battle that lasted between 5 and 10 years to gain full access to that medicine. And in the result, also take control of its own patent law, which was being challenged by this Swiss-American multinational, Novartis. In Brazil, there's been a vibrant struggle that has had some wins and some losses on finding ways to make hepatitis C treatment affordable. One of the things that happened towards the late aughts is that hepatitis C became this mushrooming, life-threatening problem in Eastern Europe and in Latin America. It's almost at the same proportions as the AIDS crisis in sub-Saharan Africa. there were no treatments for hepatitis C until this point, where one treatment, sofosbuvir, came to the market in the late aughts. It's just that it came to the market at a price of $84,000 in the United States. And even the Washington Post and the Times commented on the absurd price of this drug. This is, of course, before cancer treatments then came to the market at hundreds of thousands of dollars. And so there's an escalating layer of outrage, I suppose, that's occurred over the years. There've been a range of different problems like this. I think that what shifted in about 2016 or so, it was on Black people who were being affected by lack of access to medicines. So I think the conventional wisdom up to that point, I've been working on this since about 2003. We've never actually had to fight campaigns for British people or middle-class Americans on British and American soil. And yet last year, I worked on a campaign in the UK to gain access there for children with cystic fibrosis to a drug called Orkambi, which is, again, one of these excellent, effective treatments that can infinitely increase the quality of life and prolong the life of young children under the age of 10 with cystic fibrosis. Incredibly heartbreaking. The company was holding out on monopolies. Yeah, go ahead. Sorry.
To jump to the present while you're talking about monopolies and talking about these struggles, which there've been a deeply entrenched history over the last 20 to 30 years of struggles across the world to gain access to vital medicines. One would sort of hope that a lot of these struggles would have fundamentally transformed the practice of pharmaceutical companies as well as nation states that are in collaboration with pharmaceutical companies. So to talk about COVID-19, has that been the case? And I mean, the kind of short answer is not really, because what we're seeing now is richer countries which have procured large hordes of vaccines. They're already rolling them out to their populations. Some middle-income countries have begun this process, and vaccines are largely absent in poorer countries. So as far as COVID-19 is concerned, when we think in relation to the wonderful picture of struggle to gain access to vaccines that you've painted for us now, how come that hasn't translated so much to an equitable distribution of COVID-19 vaccines across the world? Or maybe I'm wrong, maybe it has, or it's too early to make that judgment call.
And can you, before you answer, can you also add as to like which Western countries are actually doing right? Who are the good performers even under these bad conditions?
Yeah. I'll start with that actually, because that's the easiest thing to answer. None. So none. And I think what's prevented the movement over the last 20 years from creating some kind of escalating change is that every time there's a crisis, it's confined to that particular disease. So it was the AIDS crisis, it was then the cancer crisis, the hepatitis crisis. In the US, it was the insulin crisis. In the UK, it was the cystic fibrosis crisis. It's never thought of as the pharmaceutical industry crisis, right? Which is really what it is and what we've all been suffering from these 20 years. So when we went into the COVID crisis, into the pandemic, there was already this deep and rich history, but there was also this growing awareness in places like the UK and the US, some of the richest countries on earth, that even there, middle-class people in those countries were having a really hard time accessing some of these more expensive drugs. So there was absolutely no residue from these struggles that attached itself to the pharmaceutical industry going into the pandemic. So not only did that not attach itself, but it grew worse. And the reason it grew worse is that governments sent more money towards the research and treatment, towards research into treatments and vaccines. So the first things that we had coming out in 2020 were treatments like remdesivir and later on what are called monoclonal antibodies. Now, of course, we have the vaccines emerging, but those vaccines were funded way back in 2020, and there have been several billions of dollars that have gone in both to commission the research as well as to guarantee large orders of these vaccines when they're successful. And it's sort of metastasized in a way that I really couldn't imagine. It's now been about 2 months since we've seen these jubilant scenes from the UK and the US of nurses getting the vaccines and elderly people getting them. And I am so happy to see them. I just wish that there was even a person in this country who could share in that happiness, or in countries which are even worse off than India, who don't have the capacity to make their own vaccines. Those countries are truly, truly in the worst possible situation here, because they have to depend on these ridiculous handouts. So one of the schemes, just to illustrate how ridiculous these are, one of the schemes that now is being touted everywhere is that rich countries who've bought up more vaccines than they need, like Canada, for instance, which has bought up 9 doses of each person who lives in Canada, will then donate their excess vaccines to poor countries, right? And it's just like I'm laughing. It's just so ridiculous. Like, it's unbelievable. It's really, really hard to fathom how in the 21st century, in a pandemic that's gripped the world, it's decimated the global economy, taken over 2 million lives so far, that people can think that this is somehow a reasonable measure of compassion that you can show to help people who have less access to vaccines.
So I have a sort of follow up, which is kind of based on what people who are watching are asking this question, and I want to sort of broaden it out. So I know the work is mostly India, Brazil, South Africa. Have any of these governments? How would you assess their performance around kind of procuring, manufacturing COVID vaccine? Like how should we judge them? People are sort of using words like disaster. I mean, I see a couple of comments you may have seen them on the screen with regards to South Africa. So I'm curious to know from you, like, of these different countries, like, who do you think has actually done better? I know that we have Gavi, the COVAX, this sort of broader context. But where do you see these countries like South Africa, Brazil, India fit in this story?
Yeah, so this is really interesting. I'm raising my voice a little bit because I think there's a complaint that my voice is too soft. I don't know what it is. I'm using a new set of headphones. But so if I'm screaming, then please adjust your volume. India and South Africa have been pretty good. They made a proposal at WTO to have the WTO suspend intellectual property monopolies in this pandemic. That is still being discussed. Brazil, under Bolsonaro, surprisingly, has been really bad. And what Brazil did is unconscionable, because it joined a handful of rich countries, literally about 8 rich countries, in opposing the proposal that India and South Africa floated at the WTO. Meanwhile, last week, the president, Jair Bolsonaro, wrote to the Prime Minister of India, our own fascist, to say that he needed an emergency shipment of a couple of million vaccines because their supplies of vaccines haven't kicked in as yet. What is happening in Brazil, I think, is by far the most egregious situation possible. They delayed vaccine rollouts as long as they could. They've resisted vaccines. The president has been incredibly harmful in terms of what he said about vaccines. There's a battle between the state of São Paulo and the federal administration based in Brasilia. So the São Paulo has rolled out Sinovac, a private Chinese corporation, which created a vaccine called CoronaVac just yesterday. Meanwhile, the center is trying to airlift vaccines from India. Some of their own smaller states in the north and the northwest have made their own deals with Russia. It's an unbelievable mess in which infection rates are skyrocketing, in which deaths are skyrocketing. And it's by far the country that's handled this the worst. And I think that therefore really needs to be called out. India and South Africa, I think, have been a bit feckless, aside from this one inspired proposal at the WTO, which was really the work of one South African, Mustaqim Dagama, who is the trade representative at the South African mission to the WTO. India just sort of tagged on this exercise. I think there's a curious situation happening, which is that of all of the Western vaccines that exist, you have about 9 vaccine candidates, and only 2 have thought about global access in any serious way. Only one of those vaccines has actually been approved, and that's the AstraZeneca vaccine. They've given out a contract to the Serum Institute, a large volume vaccine manufacturer in India, to produce 1 billion vaccines of the AstraZeneca candidate in 2021 and another 1 billion in 2022. These vaccines are for all low and low middle income countries, including South Africa. except the government of India is now going to decide who gets those vaccines among those many, many countries. And this is a really interesting situation because you have something that should be equitably distributed among all these countries. You could argue that they should all get the same percentage, including India. That's not going to happen. We're going to get a greater percentage because the government can take it. But at the same time, there's something almost perversely opposite that's happening in South Africa, which is that Johnson & Johnson, which has a candidate that is expected to go into approval next week, it's very, very close to being approved. They have an outsourced manufacturing contract with Aspen, which is a South African generic company, and they're making 300 million doses of this vaccine in South Africa. How many of those doses do you think will go to South Africa? Guess? 0, because Aspen will have, as per its contract with Johnson & Johnson, will have to ship those vaccines to Johnson & Johnson to distribute. So this is a really perverse situation, right? Where you have one country which is possibly meddling too much, and is probably going to take a much larger share of the pie than it deserves. And then you have this other country meddling too little, not going to take, possibly at the moment, the share of vaccines it deserves.
Goodness, I mean, I don't know how to follow up that sort of really depressing picture that you portrayed. But one question to ask maybe in relation to this is, there have been some mechanisms set up to try and bolster the coordination between different countries. And there's this vaccine alliance, which has been in place for a while, which is called Gavi. And as you've written in The Guardian, Gavi is this 20-year-old public-private partnership that believes the marriage of markets and philanthropy will bring vaccines to everyone in the world. And the COVAX facility, which is oft talked about, is a creation or initiative rather of Gavi, and it's this fund that's been created to cross-subsidize vaccine access between different countries. How is that going? Is it actually working? I mean, given what you've just told to us now, the fact that India is still able to exercise this muscle and say, no, we're still going to be the ultimate decider of which countries get these vaccines, kind of suggests these efforts aren't really working. But how much should we believe in these initiatives? The fact that they've been created through this sort of neoliberal dream of a quote-unquote public-private partnership is one thing to suggest that it ends up being feckless and doesn't really do much. But what's your take on whether or not Gavi is something that's actually creating equitable access, and whether or not this COVAX facility is a mechanism that is creating fair distribution?
The short answer for how Gavi is going is really, really badly. Gavi took in billions of dollars of public contributions from rich countries as well as corporations and the Gates Foundation to put that into a fund which they would use to subsidize coronavirus vaccines for poor countries. Now, the idea was they would buy a quantity of these vaccines and then ship them off, right? That is their traditional job. Their traditional job is to send vaccines to poor countries and to raise money from rich countries. In this pandemic, they thought that they'd pool money from both rich countries and poor countries. So they would buy for both, for all the world, so that they'd get economies of scale and they could negotiate better. So that, in the first instance, didn't work out very well, because all the rich countries, they've already bought vaccines for themselves. They don't need Gavi to buy their vaccines. So they didn't go that route in any significant way. The contributions Gavi raised fell short of what they needed. And so as a result, Gavi to date, it's now what, January 19th? Gavi hasn't shipped a single vaccine. Gavi estimates shipping vaccines towards the end of the first quarter of 2021. Gavi estimates in its first year, it might be able to cover about 3% of the population of low countries that it was set up to serve. It doesn't sound like a success to me. I mean, it honestly sounds extremely inadequate, and it sounds like a poor response. Part of the reason it's a poor response is that Gavi is stuck in a vortex of Western pharmaceutical and philanthropic dystopia, where it cannot get its head out of the idea that A, there may be vaccines outside Western countries that are worth looking at. It cannot get its head outside the idea that anything other than negotiating for small discounts with these vaccine manufacturers for subsidies to send off to poor countries, that anything outside of that would work. So it cannot, for instance, it cannot bring itself to imagine that creating licenses for production in poor countries of these Western vaccines would be a solution, because it believes fundamentally in the model that pharmaceutical industries have sold so successfully to the world, and it's now paying for it. It's paying for it because it's never had to compete in a situation where it's buying vaccines that the West actually needs. Gavi's bread and butter is, the tuberculosis vaccine, the meningitis vaccine. Nobody these things there, right? I take these things here. But it's never had to compete with well-paying customers and governments in Europe and America. It now is. And it turns out that that competition doesn't really work out well for poor countries. So they're getting the short end of the stick, and they will continue to for a while, as long as they rely solely on Gavi to get the vaccines they need to restore their economies, to restore livelihoods in the country, and to save lives.
So just one last question for you, Achal, because I know it's late where you are. What's the deal with non-Western vaccines? You've mentioned India, but what about the vaccines that have been produced by Russia and China? And then can you also, because when last year during COVID, people were also saying, let's look away from the West and look towards other kind of other examples of successfully dealing with COVID. Vietnam was mentioned, the Indian state of Kerala. But particularly with vaccines, then, has anyone planned to, or have they broken patent laws or agreements, or is nobody even trying that? Because so one is like, I know when you say Russia, China, people go, so can you say something about Russia and China, and then can you say something about what other kinds of struggles are being waged, whether at the level of governments or at the level of social movements? And I'm asking about governments because I do notice that a lot of our South African listeners, they don't actually think that the South African government is doing that well. And you are sort of, from where you're coming from, at the level of what's happening at the WTO, you can actually see some useful stuff that the South African government is doing.
So the interesting thing to know about the Chinese and Russian vaccines, which I've been working a lot on lately, is that Anban Pillay, who's the Deputy Director General of Health in South Africa, gave a radio interview to Cape Talk some weeks ago, where he said, look, these vaccines from Russia and China, some people are taking them. We don't want to bring in vaccines that might not do the job or cause some great side effects, so we will not be using them. And I say this just to illustrate what the perception of these vaccines is, not just in Western countries where they're seen as kind of a nefarious plot that has been hatched by, I think, what is astonishingly still called the communist governments of Russia and China, or other kinds of ways in which the quality of the vaccines is linked to the authoritarian and malevolent nature of the states that they come from, right? Now, living in an authoritarian and malevolent state, I can produce. There isn't a link between how evil a government is and a vaccine that then is produced in its borders. Now, the funny thing, though, is that the perception is a really strong one. Now, this is despite the fact that these vaccines have been working, they've been put into use. So while Western philanthropy has been getting its ducks in a row, I was in Dubai over Christmas. There are thousands of people who lined up every day since about the middle of December to get the Sinopharm vaccine. There are three leading candidates. So there is a Sinopharm vaccine from its different candidate that it has. There is a CoronaVac vaccine from Sinovac, which is a private corporation. And then there is Sputnik V, which is the vaccine that was developed by the Gamaleya Institute and is marketed by the Russian Sovereign Wealth Fund. Now, these are the three vaccines that have the most approvals around the world, the most number of deals around the world. Each of them has production capacities of up to 1 billion, is what they say. They've struck deals in the hundreds of millions with a range of different middle-income countries around the world. They are being used. Sinovac has been used since yesterday in Brazil. Sputnik has been used since a couple of weeks ago in Argentina. The Sinopharm vaccine, as I said, has been given up to now about 1 million people, including the ruler of the Prime Minister of the United Arab Emirates, which is a high-income country. So in a range of middle-income countries, the solution has increasingly been to move to Russia and China when they can't get what they want from Western pharmaceutical companies. In some cases, they do their own trials. Some cases, they approve it based on the data that they're given. In all cases, however, these vaccines are not particularly different. Yes, they may be tools of the state. They may be used in diplomacy. India now has a vaccine, Covaxin, which is a similar indigenous vaccine that the Indian government is already using for diplomacy. that doesn't affect the vaccine itself. The problem, I think, with the Western pharmaceutical companies is that they have held on to their monopolies. They've refused to license them, with the exception of AstraZeneca and Novavax to a lesser extent. The Russian and Chinese vaccines have shown a great willingness to license their technology, to license their intellectual property. So they have all these different outsourced sites of production where they can make many, many more vaccines. They are running cooperative clinical trials in places like Brazil or in the UAE and in a range of other countries. There are a bunch of promises that have been made to sub-Saharan African countries as a combination of grants and loans, mainly, I think, by the Chinese premier. But unfortunately, they haven't really translated into exact commitments and contracts or signed deals. And so we see very little evidence of that. We see there's a lot of talk, and there's actually fairly little evidence that there are vaccines that are being shipped to these countries as part of a solid deal. Sputnik has deals in African countries, Sudan, South Sudan, Zambia, and Guinea. But apart from these stray instances, these countries have not yet signed on the dotted line with China or Russia. But in the future, presumably, if there are ways in which the WHO can vet these vaccines and certify their quality and make people more comfortable with them, I think that indigenous non-Western vaccines from China and Russia primarily, but also from India, could be a significant solution for a lot of low and middle-income countries to find a reasonably assured way to exit this pandemic.
Thank you so much, Achal. I mean, before we let you go, I want to ask you probably the hardest question yet, which is, are you going to take the vaccine?
Yeah, I would take any vaccine that I got. Any vaccine that I got. The Indian government, as I mentioned, is authoritarian and malevolent. So we don't actually have a choice in what vaccine you can take at the moment. And that's a little annoying. I'm nowhere near any of the vulnerable categories that will be prioritized for a vaccine, as I should not be. So I think it'll be a while before anyone offers me a vaccine. But yes, absolutely. I would love to take it when it comes.
Good on you. And thank you so much, Achal, for joining us. We really appreciate you taking the time. We know it's late that side, so hope to see you soon and good luck.
Thank you.
Thank you so much. And now I think it's time to bring on our next guest, who is Dr. Indira Govender. Dr. Govender is a medical doctor and researcher based in South Africa's KwaZulu-Natal province. She works for the Africa Health Research Institute and is currently working on projects related to TB infection prevention and control for the London School of Hygiene and Tropical Medicine, and joins us to discuss COVID-quackery, I love that word, and denialism. She's also a frequent contributor to Africa as a Country, and her most recent article was titled "The Tools for Defeating Quackery." So we've asked Indira to join us to talk about COVID denialism and quackery. But first, Indira, how would you assess the South African government's COVID vaccine strategy? I mean, there's been some debate happening during this episode on the comments where a lot of people have very strong feelings about what the government is doing. So what's your impression of their efforts so far to both procure vaccines as well as to plan for rolling out those vaccines once they arrive in South African shores?
And especially if you've listened to sort of what Achal has said.
Okay, guys, I was having a really excellent connection, and just as you put me on, things started to get a bit shaky. So Murphy's Law. But thanks a lot for inviting me to join, and it's really interesting listening to Achal. Yeah, it's not looking great here in South Africa. I mean, we only just recently got a vaccine strategy coming out of the government in the past couple of weeks, and that was just bending to a lot of public pressure. And so, now we know that the government has made a plan to procure a certain proportion of vaccines through this COVAX facility. They're being criticized again for putting all their baskets in one egg, all their eggs in one basket, and not, negotiating with other countries to secure larger doses. But the plan is to now hopefully vaccinate healthcare workers at the front line because we've just lost too many. It's every day there's hearing about doctors, nurses, other frontline staff in hospitals and clinics that are dying. So really, this it's a priority.
Sean, you're on mute, man.
Yeah.
Tell you this when you said Murphy's Law, right?
Yeah.
We know that South Africa has like a very, I'm going to exaggerate and say proud history. But South Africa has a history in South Africa of government and social movements working together around medicines or drugs. I mean, the AIDS case comes to mind when in 1999, and Achal mentions that the government takes the pharmaceutical industry to court, and it has the support of the AIDS movement. Of course, we know that there was some other politics there. Mbeki was reluctant, he was denialist, and so on. But is there any appetite in South Africa for taking on big pharma on COVID, for breaking? Are you sort of rightly smiling about this? And also, might it also be that the relationship between, if you want, the government and social movements fighting around public health issues, that's changed, and not the same like it was in, say, around sort of 99, 2001, 2004, if you want?
I think that the fact that thousands of people are dying and that, this virus is decimating the country, including health services, it's just such a vicious cycle because, even with the HIV pandemic, there was the way in which that virus is transmitted. There, as a healthcare health workers that are being infected, they don't know whether they got it in their clinical space or if they got it in the community. So the way in which this virus is ravaging the country and the kind of like stalling from government is really creating a situation that's ripe for kind of mass action, is what I'd like to say. But there is also the People's Coalition, the COVID-19 People's Coalition, that is constantly trying to educate people and get more and more individuals and organizations to sign on to put pressure on the national government. The issues that Achal spoke about, about intellectual property and the World Trade Organization, that's not part of everyday conversations. It's not common knowledge. People still don't understand what these intellectual property rights mean and how they affect their access to medicines. I really wish that more people, that this information could be translated into something that is more user-friendly, that could ignite mass action, the kind of protests that we've seen in India, for example. It would be amazing to see that because it's really a very pertinent issue to our health and to our lives.
And I mean, yeah, when you talk about the government stalling amidst this awful thing, which, as you say, is decimating so many lives and livelihoods, what is it about their strategy that has meant that's the case? Because when you try to compare it to other comparable countries on the continent, as far as in terms of the economic makeup of that country, I mean, Kenya, for example, ordered 24 million doses of vaccines from AstraZeneca, and South Africa still lagging behind. Achal already explained how
South Africa ordered 1.5 million. That's it.
Exactly.
Yeah.
Not even enough to cover the healthcare workers it has to in terms of the first wave of vaccination. And Achal described how there's going to be 300 million doses of a vaccine produced on South African soil, but absolutely zero is going to come to South Africans. So, I mean, on the one level, there's this noble effort that the South African government is embarking on at the level of these institutional structures to try and fight for equitable access across the world. But in another sense, it's also, botching up securing vaccines for its own population, and in a way that seems extremely avoidable and really perplexing. And what's your sense of what's been causing?
I mean, yeah, it's really, I would say it's unclear. There's a lot of there are a lot of things you could attribute it to, maybe just poor management. But then we had this amazing ministerial advisory committee. We then also discovered that when certain of these advisors spoke out against the government's plans, they were then no longer on the committee. So there's things like that. And then, there's been like massive COVID-related corruption. And there's just a lot of distrust around whether the government is going to be able to deliver on just even the small amount of vaccines, because we know that there are massive problems with just the supply chain of medicines in general in the public sector. So how are you going to get, this in this emergency where you've had your health services partially decimated, you're not getting enough vaccines, you've got vaccine skepticism. How are you actually going to overcome that? So there are a lot of questions and there's a lot of doubt, and yeah, we just have to keep asking. And there you've got a picture of the Chief Justice who is not really helping the situation with his I would say propaganda at this point.
Which is probably how I want to get to the next question, which is around kind of COVID skepticism, which is, I'm remembering when South Africa had, in the early 2000s, with this sort of re-emergence, kind of the large scale of xenophobia, and it was found that in a lot of instances, average South Africans didn't often meet people from elsewhere on the African continent, but they somehow held xenophobic views. And so a lot of this was then traced to pronouncements by public officials, just people's skepticism about the fact that that the economic situation wasn't improving, and so they displaced that anger, the frustration onto somebody who was in the same position as theirs. And we just look at we just saw the South African Chief Justice, the image of him. I think he sort of made comments about how COVID was some satanic conspiracy, the mark of the beast, etc. Where do you think the skepticism come from? And you've mentioned sort of also like the state's inability to perform, corruption, waste. Do you think that all these things have kind of contributed to people getting into all kinds of weird theories about COVID, that it doesn't exist, or that, now with the vaccine, I won't take the vaccine because I'm looking at some website telling me not to?
Yeah, I mean, definitely the government's track record is a part of the problem. But then there's a lot of fear, there's a lot of ignorance, just, understanding basic science, understanding how vaccines work, how infectious diseases spread, where this virus came from. I would say that, in terms of a mass education program, the government has tried, but it's just, it's not adequate. And some of these questions are rooted in fear and distrust and xenophobia. I mean, at the beginning of the pandemic, this coronavirus was referred to as a Chinese virus. So, it's things like that. And if as a country you haven't addressed xenophobia, then of course that kind of sentiment latches on very easily. If you have a country where the health system is just failing people every day, it's failing 80% of this population. And just to say that, William referred to this in his paper, in his article, that Ipsos survey, you got to look at who the respondents were, and that they were mostly urban people, probably with a solid income or something, and they have the choice to say, I don't want this vaccine. But 80% of our population uses the public sector, and in the public sector, vaccines are part of the service. That's like one of the things you're not even going to be asked if you want or not. So those are the people that are going to come to clinics and expect to be vaccinated, and then probably going to be met with the same issues that have plagued the service forever. And so there's a lot of distrust and fear that that is across all I would say classes of society, all races in South Africa. There's just different reasons for this kind of vaccine skepticism.
I mean, you touched on exactly what I wanted to talk about next, because I think, referencing what I wrote about in the article, this is purely based off anecdote, which is that a lot of the vaccine skepticism seems to have this kind of distinctive middle-class character to it, just because a lot of the reasons given for it always are in advance of something else. So a lot of people saying don't take the vaccine or saying don't do it because it's an imperialist plot by the West to insert microchips into Africans and then control them and entrench their world domination. And then on the other end, there's a lot of people saying don't take the vaccine because you can't trust this government and better trust these alternative medicine practitioners like Tim Noakes who are telling us to not take the vaccine. So, and it's also this group of people that are spending a lot of their time on social media who are getting completely sort of absorbed in a lot of the stuff. But I suppose the question I want to ask in relation to that is, do you think it's also, I mean, you spoke about the government's mass education campaign, and I've started to see some of this begin in earnest over the last few weeks as the anti-vax hysteria has gone into overdrive. But is it also a failure of the government's inability to sort of, from the beginning of the pandemic, spread information about not only the virus and infectious diseases generally, but also about how it's going to be vaccinating the population and so on and so forth? And it just, I get the sense that there's also a lot of ambivalence at the level of the national government as far as wanting to immunize the population. A lot of figures there seem like they're not very trustworthy of the vaccines, and it just seems to be translating into their very sluggish efforts to try and educate the public as far as what immunization entails.
Yeah, so I would say that, you know, when the pandemic hit us, there was really no discussion at that point about vaccines. You know, we never thought that within the space of a year we'd have vaccines, because traditionally vaccine research and development takes years. So that is also part of why people ask, they have doubts about this vaccine. A lot of the questions from healthcare workers is, how is this possible that we have a vaccine so quickly? How do you know it's safe? And that really comes down to the fact that a massive amount of resources have been put into developing this vaccine to address the COVID pandemic. But I mean, so now very quickly our government has to face the fact that there is a vaccine. How are they going to get it? How are they going to administer it? And so, you know, I think just this poor management of the entire pandemic has just led to a lot of stumbling along the way. And yeah, I'm not sure if that answers your question, William. Maybe you.
Yeah. I was just going to say, it sounds like a correct picture, which is that it's almost like a lot of people are doing this to get back at the government, almost like the vaccine skepticism, as far as what you're describing now, is a sense of everything has gone so badly before, and now this final stretch when there's a sudden expectation that you're supposed to jab yourself.
I'm going to be more blunt. I think it's like two sets of people. It's one, the kind of like, it's ANC politics where you have Zuma supporters who would like to see the Ramaphosa government, you know, which is by the way very good at like what do people say? He's really good at the like TV statement to make him fail. So that's sort of there, and so they're tapping into lots of, you know, discourses and stuff that is shared with them on Twitter and Facebook and whatever. And then I think there's a sort of kind of white reactionary bit of South Africa that also gets its information from, you know, another circuit, which is sort of white supremacy, Trumpism, and you know, it's very obvious that that's the case. But I want to just link to that. There's also, like in the US, I mean, where I'm currently based, there's also like medical doctors who engage in quackery and skepticism. I mean, there's a lot of these TV doctors. I mean, I can just think of this one example, this guy called Dr. Oz. And I think there's one other one, like you'll see them on Fox, you'll see them on CNN, touting all kinds of crazy stuff. I mean, is that the case? And I know we're just talking about South Africa, but is that the case also in South Africa, that you have people who are in the medical profession who say some of these same sort of bizarre, you know, promote bizarre theories, and and vaccine skepticism. I know this, whether Tim Noakes is not a medical doctor, right? He's a nutritionist, but he's just sort of like poster boy for that kind of politics. How is that stuff? Does it matter? Is it widespread at all? And then I know I'm making this question very long, but I'm also there's always something that made me think, which is, so when there's surveys, and we mentioned this, they'll say the sample was mostly urban-based. Does that mean that rural people in South Africa trust the public health system, trust doctors, or can we not make that conclusion? Does it mean that poor Black South Africans trust the public health system even if it doesn't perform for them, or can we not make that conclusion?
I mean, one thing to add to that, which I think is interesting, is that globally, anti-vaccine skepticism tends to have a higher prevalence in wealthier countries than in poorer countries. Does that translate to the class structure of the countries themselves?
Okay, thanks. So let me try to answer Sean. So, linking back to the HIV/AIDS pandemic, we had a proliferation of quackery. The Minister of Health at the time was also promoting a lot of root vegetables as treatment for AIDS. And then there was a lot of campaigning from the TAC, from scientists as well, who were at the same time sidelined, but they kept up the fight and they brought all of the scientific evidence to light, and they kept saying that, this doesn't work and these people should be basically silenced. We shouldn't be listening to them. And I was really hoping that our government would refer to that struggle in this new struggle, because it's basically the same thing. We have a lot of people who are talking. There's so many. You turn any corner and you're going to find somebody selling a cure or potential treatment or something to COVID, or if it's not that, then it's a conspiracy theory. But we also have real doctors who are on the front line, who are dealing with like hundreds of COVID cases every day. Their ICUs are packed, their patients are dying, they're running out of ventilators, they are desperate. And this is probably something they've never experienced before. So there are a lot of impassioned pleas on social media. There are petitions going around. Just today on national radio, I heard a doctor speaking about a drug that's currently another controversy known as ivermectin. It's used to treat parasitic infections. This doctor spoke very well about how it might, reduce either treat the disease or prevent infection for COVID, and that she's planning to petition the president to fast track approval for this drug because it's currently not approved for use in COVID. So, as much as we have quackery, we also have this desperation from healthcare workers. And then you have patients who would otherwise not follow, they know where to look for their information. And then they have their doctor who's desperate, who might say, well, I have this drug that could work for you. So they trust their doctors, and they get caught up in these things. And then you have the government that is, has to follow evidence-based guidelines and science, and not put the population in harm's way, and at the same time not promote any kind of treatment that's not effective, even if it is safe for use and it's not going to do anything to you. It won't do anything to the coronavirus. So they also have to protect the population. And then you've got this massive movement on the ground. So I think there's a lot of tensions at the moment. But then to respond to the question about, whether people trust health services, when you have no other source, when the only clinic you have is like within 100-kilometer radius, and that's where you're going to go, whether you are sick, whether you've been stabbed, whether you've broken a limb, you don't have a choice. So I think a large proportion of this country is in that situation where they don't have a choice, and that's it,
Yeah. I mean, to ask you as a closing question, what is probably a bit of an unfair question, which is, what is to be done? What is to be done as far as what the government can do to adjust its strategy to feasibly procure vaccines and distribute them? So far, it's been a very aspirational strategy where by late 2021, we were already going to begin phase 3 of vaccination, which is members of the general public who aren't in the especially vulnerable groups. What can it do that? Does it need to try and strike more bilateral agreements? Is there any part to it negotiating some deal with Johnson & Johnson? And then what is to be done as far as trying to bolster vaccine willingness in the population? You mentioned this doctor who's touting ivermectin as another drug that we could use. I'm seeing a lot more people who are touting ivermectin as a drug that we could use. I'm seeing a lot of respectable figures touting it. I'm seeing a lot more respectable figures also starting to say that pursuing the path of procuring vaccines is also something that is not a successful strategy, and we should focus on just prevention and so on and learn from other countries. So it just seems like wherever you look, as you were saying just now, there's a lot of confusion, a lot of desperation, and a lot of hysteria, and yeah, what can be done to, in this vortex of chaos, to carve some, not way out necessarily, but some feasible path?
Yeah, I mean, that is a tough question. I think I'll say firstly that Achal went into detail around the mechanics of vaccine procurement, and he's exposed what is going on with South Africa's situation. So South Africans can firstly just try to educate themselves as much as possible. Try to read up about what is going on. Follow the COVID-19 People's Coalition if you can. They've broken it down very, into very user-friendly information. And just keep putting pressure, like that's what we do in South Africa. Take it to the streets if you have to, because we just can't, this is really decimating the country and our health services as well. So we just have to keep putting pressure on government for this.
And I mean, one more question, which has just popped up, and maybe it's a way to make the what is to be done question a little bit more easy to answer. What is the country we should be learning from? I mean, in the early stage of the pandemic, we were looking to places like Vietnam and India to see how they handled the difficult dilemma of whether or not to go into lockdown, if so, to what extent, and how to curb spread without being authoritarian and harsh on the population. And at this stage of immunization, what do you think is the country that is sort of getting it right?
I don't know which country is getting it right with vaccines, because as we've heard, there are countries that are basically hoarding large volumes of vaccines, and then there are countries that are exporting vaccines to other countries without thinking about their own population. And then there's a country that is going to be collecting a vaccine and then determining who gets it. So in terms of that, I don't know. But we have, you've mentioned some of the Southeast Asian countries. So they have been commended for their test and trace programs. And that is one of the things that South Africa just failed to get right, which is testing people and contact tracing, and then quarantining those who had contact with other cases, or isolating those who tested positive. So, if there was something we could have done right in the early stages, or at least use the past year to develop that system, maybe we'd be in a better position today.
Well, we're going to have to leave it at there. And it's not the most hopeful note, but I think people should feel empowered to try and put more pressure on the governments. And hopefully if the situation remains unchanging, then people won't shy away from that. So Dr. Govender, we are exceptionally grateful that you came onto the show today. We're grateful to Achal Prabhala, who was on earlier. Grateful as always to my co-host, Sean Jacobs, who had to dash off and teach a class. And to our producer, Antoinette Engel, who's in Cape Town. And please remember to like and subscribe to the program, to follow us on Facebook, Twitter, and Instagram. And join us next week, where we're going to be discussing Israel's increasing push for normalization on the African continent. Someone on the comments was saying that Israel's gotten its vaccine policy right. Well, they're not going to Palestinians, and they're literally enforcing apartheid on their soil. So we can't even look to them as an example.
Yeah.
So catch that episode next week to find out more about Israel and its horrible, horrible regime. But until then, I'll see you next time. And thank you so much for watching.
Thank you. Bye.